the need to revisit the amendments made to the World Health Organization regulations and policies against the backdrop of its global aim to ensure that people have universal health coverage has been brought to the fore. This need was highlighted by a group called the Coalition Against the WHO International Health Regulation, IHR. The group believes the amendment to some of WHO's policies is seeking to assert more dangerous control over the rights of nations in making free and independent decisions on the health of their citizens. Omolola Ololade tells us more in this report.
Over the years, the World Health Organization's primary mission has been to promote health for all through global collaboration and coordination among nations. Known for its responsibility to provide leadership on global health matters, the WHO has shaped the health research agenda while setting norms and standards and providing technical support to countries while monitoring and assessing health trends. While the WHO is planning to amend some of its international health regulations, IHR, and change critical provisions of the WHO Charter, the Coalition Against the WHO International Health Regulations is of the opinion that Nigeria should not be part of the amendment to the IHR as adopted in May 2022.
Once there's a public health emergency of international control, our constitution will be suspended and the WHO gets to decide what will happen. So what we are calling on President Tinubu to do right now is to start the process by, first of all, rejecting the amendments that were adopted last year. The deadline to reject those amendments is December 1st, 2023.
We are not interrogating the system enough. Who and who were part of the people that took a decision on behalf of Nigeria to get this particular document to our country in such a way that if the president does not write back to the World Health Organization between now and the 30th of November, that document is binding on Nigeria.
However, the coalition believes the WHO has been seeking greater power over the sovereignty of nations in the application of healthcare measures under the guise of ensuring compliance to medical interventions since the pandemic.
On a purely health level, the use of things like masks, on an economic level, locking people down and depriving them of their livelihood, the changes and the deprivations that those who were sick had to undergo because they couldn't access health care. These are all measures that the WHO had already agreed in 2019 were not measures to adopt in the middle of a pandemic, and yet they went ahead to push them in 2020.
As stakeholders continue to question the motives of the World Health Organization, the need to check loopholes in presented amendments should be addressed by the government as the protection and safety of Nigerians and the values of the country. As stakeholders continue to question the motives of the World Health Organization, the need to check loopholes in presented amendment should be addressed by the government as the protection and safety of Nigerians and the values of the country and what it stands for should be paramount. Omolola Ololade reporting for News Central.